The second part of the triple aim is reducing costs, right? And so I think that we can talk really boldly and strongly about this. That healthcare. Now, here's why healthcare is expensive. I was looking this up because I was like, why is it so expensive? We can attribute the high cost of care. A big part of it goes to administration. It's 1/4 of all costs. And I don't know if I mentioned this to you, but as we were looking this up, as we were researching this, we came across a statistic from Duke University. They have 900 hospital beds and 1,100 billing administrators. Did I tell you that one? The next, of course, is the high cost of medications, durable medical equipment, salaries, and the increased number of interventions. And I would suggest that the expense of interventions, when we talk about yoga, our interventions include things like, here's a block, So our yoga interventions are very cost effective compared to interventions when you're talking about medical community that suck up a lot of cost. So that's the reason why healthcare is so expensive. So when I think about yoga, I think about no expensive equipment, unless you have the best Manduka yoga mat, but that's not required. The equipment tends to be cheap, and the staff tends to be affordable. Even if you're paying a yoga teacher a living wage, which I would say is in the range of $60 to $75 for an hour-long class, it's still very reasonable, and it's less than all the other medical professionals are charging. The second part is the third point is group delivery equals low direct costs. From a prevention perspective, lifestyle medicine, right? The costs become almost negligible. So if you're talking about providing yoga to populations in places like schools and other institutions at the workplace, what we're talking about is prevention, and then the costs become negligible because of the money that gets saved from people not getting as sick, right? Not as stressed and not as sick. This is a hugely important point. Unfortunately, you can't really sell that to a hospital administrator because that's not the end that they're on in terms. Let's talk about the last point of the triple aim here. When the whole person is treated, the experience of care improves. So improving patient experience, right? Healthcare is transitioning from volume to value. This is an interesting point that's happening in the healthcare world right now, that we're moving from talking about seeing lots of people to having better value. And value means that the healthcare has better value, and also is of better value means it's more cost effective, right? So they're talking about value instead of volume. This is an interesting one. So how do you add value to healthcare as opposed to just trying to see lots of people? Yeah. And that's something that is being discussed right now in the healthcare world. And I think yoga can really be a great way to add value. Yoga is a simple and effective way for healthcare institutions to offer better value-based care. Yoga is empowering and person-centered rather than disease-centered. It helps patients become active participants rather than passive recipients of treatment. This is another huge point, active participants. When you're actively participating in your health is going to improve more than if you're just letting other people take care of things. It's an empowerment issue. Yoga provides valuable tools to help patients manage and improve their conditions. I talked about patient self-management earlier with diabetes, but that's true with every condition. Bottom line, improves when patients have a better experience of care. The bottom